Do you know the symptoms of diabetes that usually occur at night? Today, we are going to learn about the important but not so well-known diabetes symptoms that occur at night. I am sure these nocturnal symptoms will give you valuable insight into possible underlying health problems. Feel free to leave a comment if you experience any of the symptoms I'm about to describe. And don't forget to subscribe to our channel. First, I would like to briefly explain diabetes. What is diabetes? Diabetes mellitus is a common metabolic disorder characterized by hyperglycemia caused by defects in insulin secretion, insulin action, or both. In other words, it is a condition in which blood glucose levels are significantly higher than normal. Diabetes affects millions of people worldwide and is a major public health problem. While the daytime symptoms and complications of diabetes have been extensively documented and are well known, recognizing and understanding the symptoms that occur at night is critical to this disease. Let's start with these 7 symptoms that usually occur at night. 1. Nocturia, polyuria. Nocturia refers to the need to wake up during the night to urinate. Polyuria is when a person urinates frequently. While occasional nocturia is common, especially among the elderly, frequent nighttime urination can be a red flag for underlying health problems, including diabetes. In diabetes, nocturia is usually caused by the kidneys trying to remove excess glucose from the bloodstream by producing more urine. The constant rise in blood glucose levels leads to increased osmotic diuresis, causing the characteristic symptom of nocturia. Monitoring nighttime urine frequency and volume can provide valuable information about an individual's glycemic control and diabetes risk. You may suspect this symptom if your sleep at night is constantly interrupted by the need to urinate. 2. Hypoglycemia. Hypoglycemia, defined as blood glucose levels below the normal range, is a common and potentially life-threatening complication of diabetes. Although hypoglycemic episodes can occur at any time of day, they are particularly worrisome at night, when individuals may be unaware of symptoms or may not respond appropriately. Nocturnal hypoglycemia usually presents with symptoms such as night sweats, palpitations, confusion, and nightmares. It can pose significant risks, including cognitive dysfunction, seizures, and even death, especially in vulnerable populations such as children, the elderly, and those with autonomic neuropathy. 3. Sleep disorders. Sleep disorders are very common in people with diabetes. They include a wide range of problems, including difficulty falling asleep, frequent nighttime awakenings, and non-restful sleep. Many factors contribute to sleep problems in diabetes, including glycemic fluctuations, neuropathic pain, comorbid sleep disorders such as obstructive sleep apnea, and psychological factors such as stress and depression. Sleep disturbances not only affect quality of life, but also negatively affect glycemic control and increase the risk of diabetes-related complications. 4. Hypertension. Hypertension, or high blood pressure, is a common symptom in people with diabetes and a major risk factor for cardiovascular disease. Nocturnal hypertension, characterized by high blood pressure during the night, is particularly common in people with diabetes and is associated with an increased risk of cardiovascular events and target organ damage. 5. Enuresis. Nocturnal enuresis, commonly known as bedwetting, is the involuntary loss of urine during sleep. Although typically associated with childhood, adult-onset nocturnal enuresis can occur secondary to a variety of medical conditions, including diabetes. Diabetic neuropathy, characterized by nerve damage from chronic hyperglycemia, can affect bladder function and cause urinary incontinence, including nocturnal enuresis. It is important to differentiate between primary and secondary enuresis and to perform a thorough evaluation to identify underlying etiologies, including diabetes and its complications, in adult patients presenting with enuresis. 6. Night sweats. Nocturnal hypoglycemia, characterized by low blood glucose levels during sleep, can trigger night sweats. When blood sugar levels drop too low, the body releases stress hormones such as adrenaline to bring them back to normal. As a result, sweating occurs as a physiological response to hypoglycemia. Night sweats accompanied by other symptoms of diabetes should be evaluated immediately by a healthcare professional. 7. Tiredness on waking. Feeling extremely tired or groggy upon awakening, despite adequate sleep, may be an indicator of nocturnal fluctuations in blood glucose levels. Uncontrolled diabetes can affect sleep quality, leaving people feeling tired and lethargic in the morning. Monitoring morning fatigue levels can provide valuable information about nocturnal diabetes symptoms and overall glycemic control. Therefore, recognition of the nocturnal signs and symptoms of diabetes is critical for early detection, effective management, and improved outcomes in individuals with this chronic metabolic disorder. Healthcare professionals should maintain a high index of suspicion for nocturnal manifestations of diabetes and incorporate comprehensive assessment and monitoring strategies into routine clinical practice. By promptly addressing nocturnal symptoms and optimizing glycemic control, they can reduce the risk of diabetes-related complications and improve the quality of life of patients living with this challenging condition. However, it is important to remember that the symptoms and treatment of all diseases vary from person to person. For the best diagnosis and treatment, you should consult a healthcare professional. Yes, my friends, we have come to the end of our video. Please do not forget to like, comment, and subscribe to the channel. Thank you all for your support.